How do I fix lower back pain during squats and deadlifts? Here are the 4 steps to success. Number 1, you need to modify and or temporarily limit aggravating training and lifestyle activities to allow the irritated low back to calm down. Number 2, identify and correct mobility limitations in the ankle, hip, shoulders, and thoracic spine to reduce stress on the spine. Number 3, correct technique issues in the squat, deadlift, and Olympic lifts. Number 4, start gradually loading the spine through a progressive strengthening program. This is going to be progressive overload for the spine, and it's also going to incorporate a slow transition back to your prior training program over the course of time. So number 1, how do we modify and or temporarily limit aggravating lifestyle activities? Well, first and foremost, you have to talk to your patient and figure out what hurts, right? I always tell folks there's a lot of different flavors of low back pain. Everyone has their own little flavor, maybe a little vanilla, maybe a little pistachio. Everyone has their own specific flavor of low back pain. Certain things hurt, some things feel great. They may be completely different from one person to the next, right? So I tend to lump people into one of 2 different buckets, although there can be different flavors and a combination of both. So are you the type of person that hurts with flexion? All right. So these folks tend to hurt with sitting, especially for prolonged periods, right? One of the biggest examples is driving. So when you drive, you have to sit down in a flexed posture and you have to be in that position for a prolonged period, right? If that kills you, you may have what's called flexion-based low back pain. All right. The other thing that kills people with flexion-based low back pain is bending over to pick things off the floor because the spine has to flex in order to do that, and it kills, right? Currently, I have a bit of flexion-based low back pain, so it's bugging me to sit down right here and speak to you today. And I'll tell you what, it kills to put socks on. When I have to bend down and bring my leg up in order to put my sock on, that feels like garbage, right? On the flip side of things, some folks have what's called extension-based low back pain. So when you extend the lower back, it tends to hurt. These folks tend to hurt when reaching overhead or working overhead. They tend to hurt more with standing for prolonged periods of time. Certainly when you do an evaluation, when you have them extend from their spine, it doesn't feel good. These folks often hurt when you lay on the stomach and then especially press up from that lying on stomach position, okay? And also just keep in mind that most folks have a combination of both. And oftentimes, if you have a really irritated spine, kind of everything hurts. So it's really hard to lump someone into either flexion or extension-based low back pain. And over the course of time, as those symptoms die down a little bit, you're going to probably be able to bucket them more into one of these versus the other, okay? So what are some strategies to limit irritation when you have either flexion or extension-based low back pain? So if flexion hurts, it's probably going to help to work at a standing desk instead of sitting all the time, right? The other piece is if you have to sit, sitting in a tall seat is going to help out. It's going to reduce some of that lower back rounding. Maybe you break up bouts of sitting with frequent walks and periods of standing. You can also try sitting with a roll behind the lower back to keep the spine a little more extended while sitting, or just sit in a more extended arch position when sitting in general. So right now, like I said, flexion kind of bugs my back. So I'm sitting in a position where I'm extended a little bit. And I also elevated my seat some, and it feels pretty good on my back. I also know that after I finish recording this, I'm going to stand and walk around a little bit, right? Just to make sure my back doesn't kill for the rest of the day, okay? Now, if you're one of those folks that has extension-based low back pain, what's going to help you? So maybe you want to actually sit more frequently throughout the course of the day. We know that standing is going to irritate these folks with extension-based low back pain. So maybe we're giving them the advice to sit a little more often, right? If you do sit down, sit with a rounded lower back. Now, it's common dogma, I'll say, that when you have low back pain, you shouldn't sit with a flexed spine, right? But in folks that have extension-based low back pain, if you sit in a lot of extension, it actually feels like garbage, right? So I'll educate these patients, hey, just let your back slouch. It's okay. It's okay for you. It's not going to be a problem to slouch with your low back. It's not bad. You're not going to cause more problems, especially if that feels better. It's probably going to help you, okay? You can break up your bouts of standing with frequent periods of sitting. Okay, kind of the opposite of our flexion-based low back pain patients. You can also stand with the pelvis in a posterior pelvic tilt. Okay, so tucking your tail like a scared dog. That's a cue that I commonly use for my patients to get posterior pelvic tilt. The other piece you can try is if you need to stand for extended periods, stand with one leg elevated on a stool to round the lower back a little bit. So how do we modify the gym lifts to continue training with lower back pain? And I'm talking about squats, deadlifts, and Olympic lifts. So those are the main culprits when folks have lower back pain. So, goal number one is to find the hardest and most similar exercise variation the lower back tolerates well with minimal pain on a given training day, right? And what's my definition of tolerating something well? So, for one, it should be less than or equal to about a 3 out of 10 on a 0 out of 10 VAS pain scale. So, basically, 10 out of 10 is the worst pain imaginable, 0 is no pain, right? We're looking for minimal pain during, but we want minimal soreness after we finish the workout. We're also looking for minimal soreness the following day. If I do a workout and it's tolerated well, but the next day I feel like garbage, I probably did too much on that prior day. And here's the thing, I would say that 50% or more folks have a delayed alarm system in the sense that when they exercise, they may feel phenomenal, but they feel terrible the following day. So we need to make sure we educate our patients about this because they're constantly confused why they can exercise but feel bad the following day. Well, to a physical therapist, that might be a no-brainer, but for the patient, it often isn't. So we have to connect those two and just make sure that people understand that, right? Lastly, we're looking for progress from week to week and month to month. Okay. And this could be with pain, but also could be with loading. Let's say that, week one, I can't tolerate squatting at all. Right. And then 2 weeks later, I can tolerate squatting. And then maybe 4 weeks later, I can actually squat with a little bit of load. I may have consistent pain over those 4 weeks, but I'm actually tolerating more and more. And that's progress. All right. And here's the thing, some patients will be able to get away with minimal modifications with their training. All right. And others are going to need more drastic training modifications. And a small subset may need to completely eliminate anything that resembles a deadlift. Okay. So if you have terrible low back pain and it hurts so bad to even drive to the gym, then you may not even want to drive to the gym because once you get there, you might not be able to do anything. All right. So if that's the patient that you're working with, maybe you give them a bit of a home training program, get their low back pain down a little bit, and eventually give them the advice to get to the gym, and then we can get some work done, right? So step one, we want to try to attempt to modify the load of a given exercise, right? So if day one, your patient's supposed to deadlift, I'd like to get them to deadlift if we're able to, right? We want to keep the exercise as similar as possible to what's written, right? So the person can continue working towards their training goals. We only change the movement if we really need to. So we're probably going to have to decrease the load of a given exercise. And there's a variety of different ways to do that. Oftentimes, a reason why people can't tolerate a given exercise is because it's too heavy. All right. So how do we decrease the load but still get a training effect? Well, for one, we can reduce the RPE or the rate of perceived exertion, right? So 10 out of 10 means you're pushing as hard as you possibly can on an exercise. 7 out of 10, you had a few reps in the tank, right? So 7 out of 10 challenge is going to be a little less load. Oftentimes, you can continue progressing over the course of time and adding or continuing to work towards your training goals, right? By using a lower RPE. And I had a podcast about this. I'll leave that in the show notes as well. But you actually have similar improvements in strength, not training to failure versus training to failure. Okay. So if we have to temporarily reduce our RPEs training, we will actually continue working towards our training goals and probably increase strength and size at a similar rate as opposed to going more towards failure. Right. The other thing we can do is slow down the movement. So instead of going full speed or being explosive with our reps, we can slow them down. Maybe that's 2 seconds on the lower, 2 seconds on the way back up. And oftentimes we slow things down and reduce the load. The low back tolerates that really well. The other thing you can try is adding pauses to your reps. I do this pretty frequently. So let's say you're supposed to squat for the day, and as opposed to doing your normal sets of 5 reps, with heavy load, you can slow things down a little bit and add a pause at the bottom and the top of each movement. And what this is going to force you to do is decrease some load on the bar, but you're still going to get a good training effect, right? And the other piece that's really effective that I do all the time is just increasing the repetitions. So your 5 rep max is going to be close. It's going to be heavier, right, than your 12 rep max. So if you're supposed to be doing 5 reps on a given training day, it's pretty easy to just do 10 or 12 reps on that given training day. Oftentimes that's enough to have minimal pain while we train, right, and get through that day and spare the back, right? So what if we can't actually continue using a given exercise for the day. So I kind of fall in this boat right now. If you ask me to go deadlift, if I slow down the movement, if I increase the reps, if I tried all those strategies I just talked about, there's no way I'd be able to tolerate it. I can't even bend forward right now. Okay. So I have to modify. So step two is attempt to find a similar movement, right? So we don't want, this is a big mistake. So folks that have low back pain, right? They go to the gym, they'll say, deadlifts hurt. So I didn't do any lower body strength training. Okay. That's not good. We want to stress the area a little bit. We want to continue working towards our training goals, right? And the other piece is that another mistake people make is that they'll say deadlifting hurt. So we substituted, let's say, a squat instead, right? And although that's not a terrible substitution, it's better than just doing upper body exercises. We want to keep training as similar as possible without aggravating the area, okay? And the other piece is that stressing the area will appropriately cause adaptation of those tissues. So we want to try to find a deadlift modification that's similar, right, to the conventional deadlift that we're supposed to do that day. Before we get into the modifications, I want to give you some low back exercise prescription basics. Okay. So we need to know how we can increase or decrease stress on the spine in order to find the best exercises for the day for our patients. All right. And here's the thing, I have a very in depth lecture series about exercise prescription for lower back pain. It's inside of Fitness Pain Free Insiders, right? I'll leave a link in the show notes. It's $1 for a week trial. Okay. Super cheap. And you get a very in-depth lecture on this. So definitely check that out if you want more. But let's go over some of the basics. Okay. So the first one is going to be torso inclination. The more I incline my torso forward, the more shear force we put on the spine. And the more I send my hips back in order to do that, creates more of a moment arm at the hips. And that puts more stress on the spine as well. Okay. So if I lean my torso forward, more shear stress on the spine, larger hip moment arm, more stress on the spine as a result. Okay. The other piece that is going to increase stress on the spine is going to be how much degree of spinal motion you have. So if I go into a deeper squat or a deeper deadlift, so think about, let's say, a rock bottom squat, or think about a deficit deadlift versus a rack pull, I'm going to flex the spine a little bit more. Okay. When the spine flexes, it's just a little bit more work for the spine. And in folks that don't tolerate, let's say, flexion, oftentimes that can be a little more painful, a little more stressful. Okay. The other piece that's an absolute no-brainer is load. So heavier load is just going to be more stress on the spine. Okay. And the last one is speed of movement. So I've moved more quickly, it's more stress on the spine as opposed to moving more slowly. So think about a power clean from the floor versus a tempo deadlift. That tempo deadlift with the same load is going to be a little less stress on the spine than doing an Olympic lift with full speed. So how do we modify the squat when you have lower back pain? All right. So let's say on a given training day, you're supposed to be doing low bar back squat. Okay. And that feels terrible. We can't modify the speed of movement. We can't modify the load. It just hurts too much. What do we do? So here I have a modification ladder. So the low bar back squat is actually the toughest movement I can think of for the lower back when it comes to squatting. All right. If we want to decrease the stress on the spine, we can get a little bit more upright. Okay. We can send the knees forward some, and we can try a high bar back squat. Okay. Now, if the high bar back squat is still too painful, we can get even a little bit more upright. We can drive the knees forward a little bit more by using a front squat, which is going to get more upright in the squat or in the spine. It's also going to increase the moment arm at the knee. So it makes the knees contribute a little bit more. It takes some of the stress off the spine. Okay. If we can't tolerate a front squat, we may try a goblet squat. And the goblet squat is great because we simply can't use as much weight as a front squat. It's hard to hold a 200-pound dumbbell, right? You have to decrease the load because a goblet is just hard to carry, right? And lastly, if squatting is not feeling great, we'll switch over to a single-legged strength training exercise like a split squat, okay? So basically, we're looking to try and find the hardest variation your spine handles on that given day by utilizing the modification ladder here. Now, I have all of these modifications in the show notes. I have an entire article on how to get out of lower back pain and back to training. So if you want to download these training modifications, definitely check that out. So let's say the lower back is killing you and you're supposed to deadlift on a given training day. How do you modify things? All right. So in this modification ladder to the far left, we have the hardest exercises on the spine from a deadlifting perspective. And the hardest exercise is going to be a barbell deadlift. Okay. If barbell deadlifts are not tolerated well, first exercise I'll try next is going to be a low handle trap bar deadlift. A trap bar is going to allow the knees to travel forward a little bit. It's going to decrease the moment arm for the hips slightly. It allows the quads to produce a little bit more force. So now the legs are involved a bit more. The hips and low back are not taking as much stress. If the low handle trap bar deadlift is not tolerated, I'll try a high handle trap bar deadlift. This is going to bring the hips a little higher. It's going to decrease the torso inclination a bit. And sometimes that's enough so that you can deadlift on a given training day without much pain. If that doesn't feel great, I'll attempt an elevated kettlebell deadlift. Generally speaking, you can't utilize as heavy of a load when using a kettlebell as opposed to a trap bar. So despite the lift mechanics being very similar, usually the kettlebell deadlift is tolerated better just because the load is less. If the kettlebell deadlift is not being tolerated, I'll switch over to a hip thrust. Hip thrusts are super interesting because they're generally very well tolerated in folks that have low back pain. So if the deadlift is just not happening on a given day, we'll try the hip thrust. And what's interesting about the hip thrust is it has a very similar EMG. All the muscles in the deadlift that are very active are also very active in the hip thrust. So we're actually training a very similar set of muscles in the hip thrust as compared to the deadlift without irritating the spine. And lastly, we can try some single-legged strength training. So I prefer to use a single-legged deadlift because it's more similar to a regular deadlift. And if you can't tolerate that, then sometimes we'll switch over to, let's say, a lunge, which is a little more quad dominant, a little less stress on the spine, but still allows us to train the lower body on that given training day. How about the Olympic lifts? If your lower back is killing you and you're supposed to clean on a given day, what are you supposed to do? Okay. So the hardest exercise on the lower back from a clean perspective is going to be a full squat clean. Okay. And this is because you're lifting from the floor and you have to get into a deep squat. Both of those are pretty challenging for the lower back. So the first modification I'll try in folks who have low back pain when they clean is switching over to a power clean. Okay. So we simply eliminated the squat portion. Some folks just don't feel great in the bottom of a squat. So removing the squat portion and just doing a power clean is sometimes well tolerated. Let's say that doesn't work out well and that pulling from the floor is still pretty painful. You can try a hang clean, right? So don't allow the barbell to go past the knee, right? And you can avoid the squat too if you need to. So a hang power clean variation eliminates the pull from the floor and also eliminates the squat. And oftentimes this is tolerated well, okay? Now, if someone doesn't tolerate a hang power clean, what can you try? The last modification I would try is just a high hang power clean. The reason why the high hang is pretty nice is you just can't use as much weight, right? Because we can't create as much momentum in a high hang position. The other piece in a high hang position, torso is very upright and we're just dipping at the knees, kind of like a jerk, right? Given the torso is so upright and the weight is so low, oftentimes this is something that's tolerated really well. Okay. So hardest exercise, full clean, easiest exercise, high hang power clean, choose whatever you need to so you can actually train on that given day. Same thing goes for the snatch. So in the snatch, a full snatch is going to be the most challenging for your lower back, followed by a power snatch, followed by a hang power snatch, and lastly, high hang power snatch. So I'm always talking to my patients about how we can continue training with lower back pain, and I'll just utilize the variation that people can tolerate. And over the course of time, we just make the movements more challenging to get back to snatching. So the next one to talk about is the jerk. All right. So if your low back is not tolerating jerks on a given training day, how do we try to continue training in a way that's similar to the jerk without irritating the back? Right. I do feel that the split jerk is usually the most challenging for folks with extension-based low back pain. And this is often because of the trail leg, so the leg that's behind you when you finish a split jerk. The leg that's behind you, if your knee is not bent, it's going to extend the spine more. If you have extension-based low back pain, this can really hurt. So the first thing I'll do is I'll just tell my patients to make sure that back knee is bent and try to maintain neutral position when you catch the barbell. Okay. If that fixes the problem, then great. We don't have to modify things. However, if you're still having pain, we can try a push jerk just because you don't have the trail leg behind you. There's less extension on the spine. And if that is just not working, the back is still killing, then we'll try some other sort of overhead press modification. So we can try a barbell press. If that doesn't feel great, we can try a dumbbell press. There's a little less lumbar extension in a dumbbell press just because the barbell doesn't have to go in front of the face, right? Folks are a little more apt to lean back in a barbell press because if they don't, the barbell is going to take out their chin, right? In a dumbbell press, we don't have that problem. If that's feeling bad, we can try a half kneeling dumbbell press. Half kneel is usually helpful because we have one leg up, which is going to posteriorly tilt the pelvis and put the spine in more neutral position. Lastly, if that's still killing, we can try a seated dumbbell press. When you sit down, you have more flexion at the hips, more posterior tilt, more lumbar spine flexion. So usually it feels a little bit better. And generally speaking, we're just trying to utilize a variation that's most similar to the split jerk that you can accomplish on a given training day. And then over the course of time, we make the movements more challenging as the back starts to feel better. So one honorable mention that I wanted to talk about in folks with lower back pain is going to be blood flow restriction training. In blood flow restriction training, we're only using 20% of our 1 rep max, and we're usually doing a set rep scheme that's similar to 30 reps on your first set, followed by 30 seconds rest, and then 15 reps, 30 seconds rest, 15 reps, 30 seconds rest, and then 15 reps. So 30, 15, 15, 15 with 30 seconds rest in between, right? So if you've never tried blood flow restriction training, you're taking blood pressure cuffs. They go around your thighs. You pump the cuffs up in the lower extremity to around 80% occlusion, right? And what happens is that normally when you exercise, you have blood going to the area, and that blood causes cellular swelling, and you also get acidic byproducts that build up, right? And we believe those two things will actually increase muscle strength and hypertrophy over the course of time. When we use blood flow cuffs, we get a lot more cellular swelling and we get more acidic byproducts building up faster just because we're not allowing blood to leave the area as fast as it normally would. Okay. And what happens is the muscle fatigues way faster than it normally would. And that's what's driving some of these adaptations, right? What's cool is you only need 20% of your max to do that. So if you have a super load intolerant spine, you can get away with some good, let's say, squat and or deadlift training, right? That's going to drive some adaptations without aggravating the spine, right? And this is actually something I use all the time in my athletes that have lower back pain, they can't squat with load. It's really a nice adjunct to training to try if nothing else is working, right? And as I mentioned earlier, if you want to download all of these infographics so you can see how to modify your patient's training when they have low back pain, I have a link in the show notes under the ultimate guide to getting out of low back pain and back in the gym. Definitely check it out. Use it as a reference. They're super handy. Step 2, we're looking to identify and correct mobility limitations in the ankle, hip, shoulders, and thoracic spine to reduce stress on the lower back. So here are the general principles. Limited mobility in one area can force more work for the lower back. Okay. So if I have poor ankle dorsiflexion, or if I have poor hip flexion, then what happens is I'll descend in my squat. My hips are forced to go back further because I don't have ankle dorsiflexion. And my lower back may have to round a little bit more because I don't have the flexibility in my hips or the ankles, right? Really, we're just forcing a little bit more work for the lower back. Now, if you have a patient that has lower back pain and we back off a little bit of things to aggravate it and slowly work back to training and they're doing fine, you might not have to mobilize anything because you've shown that they can adapt to those positions well enough. And we don't have to try to mobilize things and change someone's technique. But if you have an individual that has, let's say, flexion-based low back pain, they have major stiffness in their hips and ankles, and we eliminate offending activities in the gym, offending lifestyle activities. They get out of pain. We slowly ramp them back into squatting. And what happens is that no matter what we try, we can't get their low back to adapt to the old technique that they used to use. They always keep getting flare up over the course of time. I would consider in these folks trying to change their exercise technique. You can add a heel lift, add an Olympic weightlifting shoe, mobilize the ankle, mobilize the hip, change that technique. All right. So this is kind of a nuanced discussion, but just keep in mind, we can dose stress to the spine a little bit differently just by changing mobility, right? And the areas of focus are really going to depend on your goals and the individual, right? So the thoracic spine can limit overhead motion, and it can cause a little more stress on the lower back especially if you're an Olympic weightlifter, right? The hip can certainly do the same. So if I'm limited with hip flexion range of motion, my lower back will have to round a little bit more in the bottom of squat. Same thing goes with the ankle. If I'm restricted in my ankle, it's going to force more torso inclination in the squat. It also may drive a little more hip flexion. So getting more ankle dorsiflexion will allow me to stay a little more upright, makes it a little bit more of a low back friendly movement when I'm squatting. In the front rack, if I'm limited with mobility there, it can lend to some problems in the lower back and also at the shoulder. So if I have limited motion at the shoulder, when I go overhead, I may extend the spine a little bit more in the snatch and the jerk, right? Now, here's the thing. This is not a mobility lecture. However, if you want to see all of my assessments for mobility, right, in all of these areas, then all you need to do is check out the ultimate guide to getting out of lower back pain. I have the assessment and this article in the show notes, so check that out. Okay. Step 3, we want to correct technique issues in the squat, deadlift, and Olympic lift. Here are the general principles. Now, I know I am bringing out a can of worms when I say this, but generally speaking, we're looking for a braced neutral position of the spine when we squat and we deadlift. And the idea here is that having a braced neutral position during these lifts is going to allow even dissipation of forces throughout the spine when lifting. Okay. So if I go into a squat and my spine starts to flex, that could increase some of the stress on the intervertebral discs. Okay. I know this research is mixed, right? I'm not trying to argue this point right now, but I'm generally looking to find a brace neutral position for most of the folks I'm working with. Okay. A brace neutral position is going to improve the low back muscles efficiency to reduce shearing forces in the spine. Okay. When I do a deadlift or a squat, my torso is going to incline forward, and that's quite a bit of shear force. If I'm neutral, it's going to help out those muscles. Okay. Lumbar rounding or flexion of the spine can put more stress on the anterior structures on the spine, like we talked about. So the anterior structures on the spine are kind of the spinal discs. And if the spinal discs are taking too much stress over the course of time, if what you're doing is exceeding the disc's ability to handle the loads, right? If the recovery that you have in between sessions is not enough, if the annular wall is not strong enough, you may cause a disc issue that may cause problems over the course of time. Same thing goes with lumbar extension. So if you extend too much during a squat, deadlift, any Olympic lifts, if you arch the spine too much when you press overhead or when you're bench pressing, this is going to cause more compressive stress on the elements on the posterior or backside of the spine. And maybe that's going to lead to more spondy issues over the course of time as opposed to staying a little bit more neutral. Okay. So that's constantly what's going on in my mind when someone has a low back issue. We're trying to figure out how can we be a little bit nicer on the spine in the future from a technique perspective. Okay. So we want to be able to coach a brace neutral position in squats, deadlifts, and our overhead lifts. Now I have some really good videos on how to do this, and I'll put the link in the show notes for the squats as well as deadlifts. Okay. When it comes to overhead lifts, the same rules apply. We want to stay braced and neutral. So you have someone that is hyperextended when they press overhead. We want to make sure we're coaching them and cueing them appropriately so they stay a little bit more neutral. Okay. Like I said earlier, if they're extending too much during split jerks, we have to make sure that backside leg, that trail leg knee is bent, the glute is flexed, and we're holding our torso in a neutral position. Okay. If someone has a lot of overhead mobility limitations, they're naturally going to arch a little bit more. So we may have to mobilize the thoracic spine, mobilize the shoulder, decrease the load a little bit so they can press overhead in a more neutral position over the course of time. All right. Step number 4, we want to start gradually loading the spine through a progressive strengthening program. Okay. And here's the thing, in the large majority of the rehab programs that I write, and this is not just for low back pain, it's for most things, but certainly with low back pain, our goal is to reduce the intensity of exercise, but we're increasing the frequency of exercise. Okay. So that may mean I am reducing the weight on the bar, but I'm actually stressing the spine more frequently than I normally do. Okay. We're going to put more focus on the injured area and the helper muscles. So in terms of stressing the injury site, I want to do this 3 times per week, right? So I'm going to do exercises for the lumbar spine 3 times a week. And the goal is to drive tissue adaptation, right? I want to have the structures in the spine to adapt to the training stresses. Okay. We're also going to be working the helper muscles, and we're doing this 3 times a week. Which movements or which muscles are these? The glutes, the core, hamstrings, and even the quads and the calves. Okay. All of these things are going to help to contribute to force production during squats, deadlifts, and Olympic lifts. And I want them all to be up to snuff so I can optimize my movement. Okay. And lastly, we're looking towards building a balanced strength training program. Okay. So, generally speaking, if you're following or if your patient is following a strength training program that's smart and it was designed for them, I actually want them to continue with that program as much as possible while we're rehabbing. Okay. So, continue with the upper body stuff. Don't stop doing everything else because I think that's actually important, A, for working towards your fitness goals, but B, I think it's going to allow you to help rehab a bit faster as well and keep your sanity. So here's what I want you to do next, guys. If you enjoyed this video so far, I have an entire course. It's free. It's called the Fitness Pain Free Mini Course. And we go over 3 lessons going to help you take a lot of this information that we went over so far and put it into practice. The first lecture is called Why We Need a Better System. So first and foremost, the way we treat fitness individuals, all right, athletic people in the gym from a physical therapy perspective is pretty much broke, okay? So we need a better system to serve the folks that are in the gym that get hurt. They want to get back to training, all right? Lecture number 2 is called 7 Reasons Why People Get Hurt in the Gym. And essentially, we have to know the reasons why people get hurt in the gym so we can keep them safe in the future, right? And when they get hurt, we have to know why and how to get them back to training in the gym. Okay. So a thorough understanding of this is very, very important. I actually have a really cool infographic that goes along with this lecture that you get for free as well. And lastly, we go over a case study of how to get someone out of pain and back to training. So these principles are all phenomenal, but we don't actually put it together and you don't understand how to create a program to get people back in the gym and keep them safe for the long term, then we lose, right? So I'll put a link in the show notes for this. It's a Fitness Pain Free Mini Course. Definitely check this out.